Are you interested in pregnancy? If no, please raise your hand. For those remaining, this is the right show for you. In this 10-part lesson of Pregnancy 101, I'll be covering the topic of ultrasound. So far, we have touched bases with the physical changes during pregnancy. This includes coping with morning sickness, fatigue, food cravings. So let's get started with today's lessons. At some stage of the pregnancy, all mothers have to go through a medical screening to monitor their child's development. This involves the use of diagnostic ultrasound. Don't worry ladies, it is nowhere as near as dangerous as radiation. In fact, it's purely harmless. Still worried? Don't be, because I'm going to explain the physics behind ultrasound. Firstly, for an ultrasound to happen, we need to create an image on the screen. This is done by generating sound waves to reflect inside the body. Not ocean waves, but sound waves. In this world, there are two different types of waves, transverse and longitudinal. These waves travel through vibration, passing on energy without moving. The vibration in transverse wave travel at a right angle to the direction of the energy travel, while the vibration in the longitudinal wave travel alongside the direction of the energy travel. Too scientific? Well, in simple terms, transverse wave vibrate up, down, while longitudinal wave vibrate left or right. They both require substances to carry the wave. Ultrasounds are considered to be longitudinal sound waves. Within a wave, it consists of the amplitude, which is the maximum or minimum height the wave reaches, the wavelength, which is the distance of one complete wave, the period, the time taken for one complete wave, and the frequency, the number of complete waves that occurs in 1 second. In an ultrasound, the sound waves are created and detected by a handheld object called the transducer. A transducer can convert any type of energy. It uses piezoelectric effect, which happens when pressure is applied to certain crystals and it becomes positive on one end and negative on the other. This creates a difference in its total electrical charge. On both sides of the crystal layer, there's a thin metal plate called electrode. If the electrode are not being squished or pulled, they remain neutral. An electric current is fed to the transducer, and depending on the charge of the current, the crystal disc expands or contracts. Therefore, the electrical supply needs to be alternating to generate a sound wave. Sound waves have high and low pressure areas. The high pressure areas squish the piezoelectric crystal, making one electrode slightly negative, while the low pressure area stretches the crystal, creating a difference in its total electrical charge. The alternating high and low pressure areas in the sound wave goes through the transducer and creates an alternating current to send back to the computer. This generates an image. Meanwhile, the sound wave is transmitted through a medium in the body. Hence, some of the energy will be absorbed and loses its specific concentration. This gradual decline of intensity is called attenuation. So the higher the frequency, the lower the rate of efficiency. This can be measured by the acoustic impedance, where the acoustic impedance is the density of the medium times by the speed of sound in the medium. The remaining sound wave is then reflected off the interior organs and back to the transducer. Knowing what happens inside our body, we can now move on to interpreting the images on the screen. There are 3 ways to do it: A-scan, B-scan, and Doppler effect. A-scan is the simplest type of ultrasound. A single transducer scans a line through the body with the reflection plotted on the screen as the depth of the surface. Each peak represents a tissue boundary. Hence, the time between the peak is the distance the wave travels to the tissue boundary. Therapeutic ultrasound, aimed at a specific tumor, uses A-scan to allow for pinpoint accuracy focus on the destructive wave energy. In the B-scan ultrasound, rows of transducers simultaneously scan the body so it can be viewed as a 2-dimensional image on a screen. Each dot is a tissue boundary, and the larger the amplitude of the reflected pulse, the brighter the dot produced. This generates a real-time image. Lastly, using the Doppler effect, we can use ultrasound to work out the speed of the moving object in the body to measure specifically the rate of blood flow. It works using wavelengths. When something moves away from you, it has a longer wavelength. When it moves towards you, the wavelengths get shorter. Hence, when there is no movement of the blood in a nearby vessel, it represents a blood clot. This is important for checking on a baby's heart. Ultrasounds are not only used for pregnancy, but also to examine other body organs and systems, such as the heart, gallbladder, joints, and muscles. It can also be used to guide medical procedures like knifeless surgery, and especially to treat sports injuries. It is not dangerous as long as your doctor does not crank up the machine, causing the air bubbles in the cell to explode and destroy chromosomes. My advice is to go to a legitimate hospital or clinic if you ever need an ultrasound. Well, my time is up, and this has been Pregnancy 101. Remember, ultrasounds are helpful and harmless. See you all next time.